Several years. Good morning, everyone. Welcome to House Healthcare. It's Thursday, April 6th, and we are continuing our testimony on S37. This morning, for the first hour and a half or so, we're going to be focused on Section 8. I'm going to go back to my list from Ledge Council. Section 8, establish a new and unfair and deceptive act regarding pregnancy centers to prohibit false and misleading advertising about their services is what Section 8 is intended to do. So we're going to start with Cindy Bruzzese. Thank you. And we don't use last names in this committee because I'm really bad at it. So
it's totally fine. No one says my last name anywhere.
Okay.
Wherever I go, they just say Cindy, that person, exactly. All right. So if you can introduce yourself and who you are and what you do, and then start with your testimony, that would be great.
Sure.
Thanks so much. I'm Cindy Bruzzese. I am the executive director and ethicist at the Vermont Ethics Network. And I also work part-time as a clinical ethicist at UVM Medical Center. In addition to that, I direct the statewide task force on palliative care and pain management. And I chair the ethics committee for the Department of Disabilities, Aging, and Independent Living for people who are under public guardianship, who have developmental disability. So I wear a multitude of hats. And so today I was asked, and thank you again for the invitation to testify in S37. I testified in the Senate committee when this was discussed earlier in the session. And I understand there is a growing concern across the country, it's not just here in Vermont, surrounding the advertising practices of pregnancy service centers. And the concern really centers around the use of misleading advertisements that induce women to come to the centers, and then the dissemination of information about abortion that's inaccurate and inconsistent with evidence-based clinical medicine. So that's kind of the concern that's out there. I recognize that there are First Amendment considerations that you as policymakers are weighing. You decide, whether and how to try to regulate information that's on websites and advertisements and even printed materials that are distributed. So my purpose actually today is really to speak more broadly to the ethical implications of deception and misinformation as it relates to medical decision-making and patient-centered care. So what does that mean for people if they aren't getting accurate information? What are the ethics around that? So I think, it's important to sort of start with some definitions, which seemed odd to me at first, but then I thought, well, maybe this is helpful. So ethics definitions, when we think about what is lying? So ethically, it's statements that are made by an individual who knows they're false or believes them to be false, and they're deliberately intended to mislead the listener. That's what lying is. Deception is broader than that. It includes all statements and actions that are intended to mislead the listener, whether or not the statements are literally true. So some techniques that are used to deceive patients is when we use a lot of technical jargon that we know they don't understand, or we make ambiguous statements that makes it unclear what we really mean, or we're giving misleading or incomplete statistics to try to slant the conversation in a certain direction, or not answering questions directly, just simply not responding to the question that's asked, or omitting important qualifying or contextual information. So this isn't just about pregnancy service, this is about healthcare in general. This kind of thing happens intentionally and unintentionally sometimes, but we need to be mindful of it from an ethics perspective as it relates to medical decision making. And then misrepresentation is unintentional or intentional statements that may or may not be true. And unintentional misrepresentations can occur because people don't have experience. They just don't really know. They're not trying to do this, but they don't know the answers, or they have lack of knowledge or just poor training and communication skills. They're not intending to misrepresent things, but that's ultimately what ends up happening. So in general, there's a strong ethical objection to lying, deceiving, and intentionally misrepresenting people. I think everyone can agree that is, and generally there's objections to that. I think this is even more so true when it comes to medical decision-making, because in contemporary society, we place a huge amount of weight on patient autonomy and informed consent. And that's a necessity if we're going to have any type of trust in a clinician-patient relationship. So this state in particular, but certainly this country, is very much founded on this concept. And I was reading empowering people to participate in their own healthcare to the best of their capacity. People need to have accurate information in order to make informed decisions. And that's how we respect patients, by giving them accurate information and respecting their autonomy. So as it relates to this particular issue, truth-telling in my work is a near absolute. Sometimes people say, well, just don't tell them. And I'm like, it's tough to it's tough to ask an ethicist not to tell somebody something that's the truth. It's how trained healthcare professionals demonstrate that they respect patients. It's how they foster trust. It's how they promote self-determination and cultivate an environment where best practice and shared decision-making can really flourish. Without veracity and information and communication, it's really difficult for individuals to make informed voluntary choices. And that's essential if we want to fulfill our autonomy-based obligations as healthcare professionals. So any advertising strategies or information that about healthcare options that lack transparency, that use misleading or ambiguous terminology, that misrepresent services that are provided, or provide factually inaccurate information are a form of manipulation that disrespects patients, it undermines trust, and it broadens healthcare disparity and can result in patient harm. So lying isn't okay. And I'm sure you didn't need the ethicist to come in here and tell you that. The other piece of this, besides just that, is sort of professional responsibility and scope. So medical professionals have responsibilities to do good for their patients. This, in my world, this is the beneficence piece, right, of ethics. They need to provide comprehensive, accurate, evidence-based clinical information. And they need to avoid disproportionate harms or burdens. That's the non-maleficence piece of the ethics work that I do. So we've touched now on 3 of the 4 principles: autonomy, beneficence, non-maleficence. These are sort of core, well-respected principles in bioethics. And so professionals have these fundamental obligations. If they misrepresent services or provide inaccurate information about abortion and its risks, and the lack of transparency about access to abortion or referrals, that could present disproportionate burdens that lead to delayed opportunity for timely interventions, resulting in increased risks to women's health and undermining their well-being. Violations of these fundamental beneficence and non-maleficence obligations just are not ethically defensible through my lens. They're also obligated to engage with patients in a morally neutral manner. This is something that we work with healthcare professionals all the time. They need to check their own personal views and biases at the door and meet patients where they're at in a morally neutral, judgment-free way. This is what we call prioritizing the primacy of the patient's interests. They need to do that over their own self-interest. It's really all about the patient. So it's my understanding that these service centers that are operating across the country and also in Vermont are actually not medical clinics. I did research before I testified in the Senate, and I couldn't find anywhere the training of the staff that staff these. But I know you have someone testifying, so I'm sure can clarify that. But based on the prior testimony of some medical providers that you're going to hear from later today, that these are not medically trained professionals. They're non-medical centers that provide more of a faith-based perspective on pregnancy and abortion from lay volunteers. Informing and counseling patients about risks, benefits, and alternatives of medical procedures, those are the core elements of the informed consent process, and it's the foundation of the clinician-patient relationship. The responsibility for obtaining informed consent, it rests squarely within the scope of practice of physicians, advanced practice nurses, and physician's assistants. We don't let just anyone do an informed consent in the hospital or anywhere. It has to be someone with a level of training that's within their scope of practice. It's ethically problematic, if not wholly impermissible, for individuals with no limited training or medical knowledge to engage in clinical discussions and counsel on medical procedures that are beyond their scope of training and expertise. So doing so is sort of like practicing medicine without a license, and it can represent a safety issue. It can put the health and welfare of women at risk, and it does erode public trust in medical profession overall. So we need to have the people that have the expertise and the training doing the communicating about these kinds of procedures. So honest information about the perspectives from which these services dispense advice and support, in addition to forthright acknowledgement of their limitations, is essential for them to provide ethical services to women. So we support the inclusion of language to curtail the dissemination of deceptive or inaccurate information pertaining to abortion and those services related or provided by these centers.
Thank you very much. Are there any questions for Cindy?
Cindy,
Hi.
you made some pretty strong statements here. Have you gone to one of these centers that you're talking about?
I've never been to one of these centers. I think you can, you're going to hear from people that have been to these centers and they can describe their experiences.
Thank you.
Anyone else?
Yeah, I guess I got a question just for my, what is the truth? You know, the truth is supposed to be on data, facts, and everything, but sometimes we don't find out the truth until down the road. So to me, it's very important that we use common sense also in these truths, because what's true today might not be true down the road. And I have a self-problem with that, an issue.
Well, I totally agree. I mean, what's true today may change tomorrow as the medical facts change. I think what I'm saying as it relates to sort of this particular issue and topic is that if abortion services are not actually provided, we should just disclose that right out of the gate. So people know exactly what they are, where they're going and what kind of services they're going to be provided. So we wouldn't want people to think they could come into a clinic and get a service that the clinic has no intention of providing. And so we just need to be transparent about that up front so people can make an informed choice and come in and get the services that that clinic is providing. I have no objection to the clinics providing the services they provide as long as it's transparent to the people who are coming in what they're getting.
Art?
Yeah, do abortion clinics tell the truth about what abortion is and what medical abortion is and the horror of abortion? Do they tell the truth?
Well, I would hope so. They're medical professionals, and I would say that, you know, a Planned Parenthood or any other clinic is held to the exact same standard that I would hold these clinics. The ethics are the same. They need to tell the truth. They need to be transparent and disclose factually accurate information. So I can't speak to all abortion clinics, but I would hold them to the same ethical standard that I would hold any other medical professional.
So your information is for all?
Absolutely.
Okay.
Abortion clinics should be disseminating accurate information. They should be having trained medical professionals. So it's the same thing.
Okay.
Yes.
Okay. So Cindy's here to talk about the ethics, not necessarily the specific centers, right?
Right.
So
but
what is
ethics of it need to be discussed in the
Right.
abortion clinics,
right?
in my opinion.
Well, the transparent information needs to be discussed as well. They need to know what the patient needs to know what is offered in those services, just like we're requiring, or we may be requiring people to know what happens in these crisis centers, what services are and are not available in these centers as well. So, any other questions for Cindy?
I would just say thank you for your work, because you know, having been in the healthcare field and advocacy and policy for some time, I've never heard such a eloquent description of the ethics. And just thank you for lifting that up, because it can be applied to so many areas of the work that we do. And just thank you for such a good description. And it's such a fascinating lens that we should all be looking at the work we do through. So thank you.
You're welcome. Thank you for having me. Yeah, we're a unique state to have an organization like the Vermont Ethics Network, which is a freestanding, not-for-profit ethics organization that supports healthcare providers of all stripes as it relates to medical decision-making and just ethics. I mean, ethical conflict is inherent in clinical medicine. I mean, there's going to be tensions, even when you're doing everything correct. Sometimes people want things that we can't provide. Sometimes we want to help people and they don't want our help, and it creates a tension. And so having a resource like this in Vermont is truly unique. And it's been a privilege for the last 15 years to work there.
Thank you, Cindy, very much.
Thank you.
Did we get a copy? Is that gonna be?
It's on the website.
Oh, okay, great.
It is on the Affinity page, yes.
Thanks.
All right, Deb, are you there?
Yes. Good morning.
Good morning. And it's Deb Kuchar, is that right?
Yes.
Okay, great. Wonderful. Thank you for coming. I don't believe you submit written testimony, correct?
Correct.
Okay.
I did not find out about this until yesterday, and I was out of town.
I'm sorry. Okay. Well, thank you for finding the time. And we appreciate you being here. So if you would introduce yourself for the record, and then I'm sure you have some testimony prepared in your mind, but we'd love to understand what you do in your center.
Yes. Thank you, first of all, for accepting my testimony. And I'm sorry, what did you want me to start?
Just introduce yourself, your name, and your where you're employed. And
Okay. Deb Kuchar, I'm the center director in Williston, Vermont at Aspire Now.
great.
Okay. Well, I'm obviously in opposition to S37, which says that we provide fraud, which we do not. All of the Vermont centers are affiliated with national organizations that hold us to a very high standard. We have to sign a commitment of excellence and a commitment of care every year in order to remain affiliated with them. And so we obviously agree that with Cindy that, we're telling the truth and, we are transparent. I would like to know, when has someone complained about a pregnancy center or about us promoting fraudulent statements? We have never seen anything. Our clients give us very high ranks as far as, the care that they receive here. And I've never heard anyone complain that we've, falsely advertised to them.
So we are having the Attorney General in later on, and we'll ask that question.
Okay. I know that our clients, typically we have a 98 to 99% satisfaction rate for our clients. So they don't often, post, because they want to remain anonymous. So, they're not out there, posting stuff on social media and stuff, if they want to remain anonymous. And I'm wondering why only pregnancy resource centers are being targeted. Whatever regulations you put on us, they should also be put on abortion providers. It should be the same across the board.
We agree. I think what would be helpful, Deb, is if you explain what you do as a crisis pregnancy center. So it would, like, someone comes to your door,
Yep.
what services are offered,
Yep.
If someone wants an abortion, what happens? If you can just walk us through a patient experience, that would be very helpful.
Yeah. So when they come in, or even before they come in, they know that we do not perform abortion. We have it on our website, and we do have a written disclosure that they sign before any services are provided for them.
Okay.
And we ask them, what they're looking for. Are they looking for a pregnancy test? Are they looking for STI testing? Are they looking for an ultrasound? And we meet with them, we get to know them, and we just walk with them through whatever is going on in their life at that moment, and provide the services that they're looking for. And we have not ever had anyone request a referral for an abortion because they know where to go. People know that Planned Parenthood does abortions. So, they don't need a referral. They already know where to go if they want an abortion. So we provide ongoing support, we provide life skills, we provide coaching, we provide support right through the child goes to kindergarten. You know, as far as support for parenting and stuff like that, or if they're making an adoption plan, we provide ongoing support for them.
Great, thank you. I don't want to, if you have other pieces of your testimony, I don't want to cut it off, but I do know we have some questions around the table. But I want to give you a chance to finish whatever you.
Yep, I do want to say that we do not charge for our services. Our services are free. We do not accept insurance. We receive no state or federal money, and we must raise all our money through fundraising, grants, supports from individuals, businesses, and churches. In fact, I have a fundraising kickoff today. So rather than increasing the state's tax load, we're saving Vermonters thousands of dollars every year by providing services to clients at no cost. So in 2021, we saved the state $368,325. And in 2022, we saved Vermont $395,770 by providing these services free of charge.
Is that something that you could copy and send in to us?
Yes.
So we could see the information? Thank you.
Yep. And I want to say that according to the Charlotte Lozier Institute's most recent survey, they found that 61% of women were coerced or felt coerced to have an abortion. As a result, the abortion experience disrupted their daily life, work, and relationships. They had more frequent thoughts, dreams, and flashbacks of the abortion. And in addition, their overall mental health declined. We encourage women to take some time to research all their options in order to make the best decision for them. And we welcome them back no matter what they choose. In fact, for a woman who really does not know what she wants to do, we use a pregnancy decision aid, and this came from the emergency room at the Ottawa Hospital. And it goes through all the pros and cons of adoption, of parenting, and of abortion. And what we do is we just write down exactly what the client says. And then we go back through and we read it to them and we ask them, how important is that to them? And then when we get done, we ask them to bring this home. We make a copy of it and we bring it home. And we ask them to come back in a week. And so that if they have any questions that come up over that time, that they can come back and ask us. So we do not coerce anyone. You know, they make their own decision. Let's see. We had one client who told us that she was going to have an abortion, and we asked her for permission to follow up with her. And when we called her, she was planning her suicide. She said that she didn't realize how devastated she would be afterwards. She said, you know, you told me that there could be some psychological risks or emotional risks, and she thought she could handle it. We asked her if she could come in, and she came in that day, and we worked with her over the next several months. And when she got done, she received her healing. About a couple months later, she wrote a testimony against abortion, and she felt that she was coerced and manipulated by Planned Parenthood to go through with the abortion. And I've got, you know, a lot of clients say, you know, we ask them to complete an exit survey, and this is what they say. I would absolutely encourage a friend to come here. Very peaceful atmosphere, caring staff members, educational and informative. Thank you, thank you, thank you. They listen to what you say. I would definitely come back again. It was private and the staff was friendly and cordial. I was able to talk with someone who really listened. I want to come back. I love the lady. She made me feel so much better about my situation, and I feel better. Thank you so much for your support. Your office was amazing. I couldn't have had a better visit. I would encourage a friend because it's a lot of scientific information and support in a comfortable environment. Thank you. Amazing place. Another woman said, thanks. I wish every woman had this available to her. Another one, I've been here more than once and everyone is so respectful and kind to your needs. My experience was better than expected, very supportive and non-judgmental. We have clients who have been here. I had one client who came back 5 times with 5 different partners. And she said she knew she could come here because we weren't going to be judgmental about her situation. Also worked with people who have, DCF involvement. We provide parenting for them. There are sometimes dads wanting to get their children, and so they need parenting support, and we provide that for them so that they can get their children back, or so that, they can have their children. And we had one couple who was working with DCF, and the boyfriend had an anger issue. And unfortunately, my papers got all disorganized here.
Take your time.
Okay, so they were pregnant at the time. They were referred to us from the Howard Center, and the young man came to us angry and abusive in his relationships and fearful of what the future would hold if he continued this pattern. And we worked with this couple on parenting education and our cultivating healthy relationship curriculum. This was the first place that the young man felt safe enough to share the hurts of his past and to work through them. And through the weeks, he began practicing what he had learned about good communication and boundaries. At the following visit, he shared that he was able to walk away from someone who was verbally abusive and getting aggressive toward him. In the past, he would have gotten into a brawl that may have included the police. And so the Howard Center caseworker asked to meet with us because she wanted to know what programs we were using with this couple, because she had seen an enormous positive change in both of them, and they were able to get their children back, and DCF closed the case. Those are just a couple of stories.
Great, thank you for sharing those. And I want to be clear, we appreciate the care that you provide to families. We just want to make sure that all information is disseminated appropriately. So thank you for the care that you are providing to Vermonters. I think we have some questions. Leslie raised her hand first, and then Alyssa, and then Art, and then Mari. Maybe.
Hey, so, yeah.
Go ahead, yes.
Yeah, so thank you, Deb. I'm looking at the Aspire Now website, and I don't see any mention of the staff or the credentials of any of the staff. So I was wondering if you could speak to that. One of the photographs shows a person in a white coat with a stethoscope around their neck. So I was just hoping you could speak to sort of that image and also who your staff is.
Yeah, we have an RN sonographer. We have 2 RN sonographers that do our ultrasounds and all, all the medical information. So when people want to know about the medical effects of an abortion, they see the nurse. And they are, Vermont licensed nurses who, are registered, they're RNs. And they have to take specific ultrasound training in order to be credentialed to provide obstetrical ultrasound.
Thank you. When the
I did want to add, you asked about why our staff is not shown on our website.
Yeah.
That's for staff protection. We know that many people are against us. Jane's Revenge violated a center in Burlington. And we know that there are a lot of hateful people. And so it's for the protection of our staff.
So
yeah.
How do you address, we were hearing about informed consent. So I was wondering how you address that issue in this context. That, let's see, I'm going back to here's the scope of practice. Informed consent rests squarely within the scope of practice, physicians, advanced practice, nurses, and physicians assistants. So how do you address that issue?
They fill out a request for services and we disclaim everything that we provide and what we don't provide. I guess I'm not sure what you're saying beyond that.
Okay, thank you.
You good?
Yeah.
I'm sorry, Leslie, Alyssa?
Yes, thank you, and thank you for being here. And so Leslie had asked my first question, which was what medical qualifications you have employed in your clinic. But mainly, again, I'm on the website as well. And you had made mention that it's very clear that we do not perform abortion services or refer for abortion. And yet your website is completely riddled with information about abortion, abortion pill information, ultrasound information. I was wondering if you could speak specifically to, it seems that you have a requirement on all of your services that you provide that someone must have an ultrasound because it's implied that it's medically necessary for abortion services or abortion pill. And I'm wondering if that's evidence-based.
Yes. So, and a urine pregnancy test will, say that someone is pregnant or that they have it's a positive result, that they have a raised HGC level. However, did I say
HCG.
HCG? However, it doesn't tell where the pregnancy is located and if it's a viable pregnancy. An ultrasound will tell those things. It will show that the pregnancy is in the uterus and that it is viable with a beating heart. So that is what they need to know going forward, no matter what they choose.
But if you don't perform or refer abortions, then why does somebody need an ultrasound?
So they know that they're not having an ectopic pregnancy.
Okay. I mean,
Because
I personally had 3 children and I never had an ultrasound on any of them except for the third one when I was about 8 months pregnant. So I'm just wondering, is that standard of care? And do you have physicians employed there that would?
Yes, we have a medical director that oversees everything.
Where is your medical director located? In the clinic?
She comes to the clinic, yes. She's not here all the time, but she is in the clinic.
Okay. Again, based on your testimony, and I'm looking at your website, if I was a woman in Chittenden County searching for options, your website is very appealing to me because you really lay out, all the services that you're providing, and abortion information appears to be one of them, including in the blogs, in the menu. So I'm not sure that you are making it particularly clear that you don't have these services. I might check the website.
It does state on our website that we do not perform or refer for anything that will harm viability. And we do provide a lot of information. And again, all the medical information is disseminated through our RNs.
Last thing, I was wondering if you maybe could submit to our committee assistant some of the written information that you give out to patients or clients.
Actually, we don't give out much written information. It's more verbal. I mean, we do give them out, information about miscarriage risks, ectopic pregnancy risks.
That would be great if you could send along any of the information. And I think you also said that you have a waiver.
Yes.
Can you send along that waiver as well?
Yeah.
Are you good?
Yeah.
Art?
Yes, thank you. I'm wondering how you, how many would you say women, pregnant women that come in, what percentage roughly decide, no, you know what we want, I do want to pursue an abortion? I mean, and how they're treated in terms of that. So, and pardon my ignorance here a little bit, but someone comes in, here's what you have to say, and says, you know, I'm going to terminate this pregnancy. And I wonder what, if anything, you tell them as they walk out the door to one of the abortion places.
Yeah, we invite them back.
Okay. But I
No,
mean, you're
we ask
not,
if we can follow up with them. And then we invite them to come back if they want, you know, like that one that I shared about who was planning her suicide. You know, we had told her prior to that we offer abortion recovery. And when we called, you know, to check on her, and she was planning her suicide, and we saved her life. You know, we called at the right time, and she came in that day, and we saved her life.
what would you say is the rough percentage of how many women might leave to have an abortion versus those that use your care and your help to carry the pregnancy to
Yeah, it's a low percentage. Yeah, I don't know.
Do you have any follow-up testimony from those folks who say, yeah, I had an abortion, but you helped me anyway, type of thing? I mean, do you get that kind of feedback?
Often they'll tell us that over the phone, but I can remember one client that I called personally, and she was just so surprised that we followed up with her.
Yeah.
She just kept saying, you know, thank you so much for, you know, checking in.
Yeah.
And she was just really surprised that we followed through.
Thank you.
I want to just, so we have a lot of questions. I want to follow up on Art and Alyssa's question. So just to confirm with Alyssa's question, if someone comes in and asks about your services, I want to confirm that the first step, if they continue on, is a urine pregnancy test, and then a second step is an ultrasound. That those two things must happen to continue to.
No, not everything is by permission. We don't mandate anything. We recommend that they have an ultrasound to make sure they have a viable pregnancy.
And so how many, off the top of your head, what is the percentage of people that have an ultrasound?
Most of them, probably 99%.
Okay. And do you also?
It's very rare that they don't.
Do you also, and that's at any point, whether it's 6 weeks or, okay.
Yeah.
And to follow up on Art's question, do you keep any statistics on people who come to your clinic and then just don't come back and you don't know where they went? Because I think there is, and Art, I understand your question, so don't take this the wrong way,
No.
like there's the I'm gonna leave because I want to have an abortion, and there's I'm gonna leave and I'm not telling you why I'm leaving, I'm just leaving. I'm wondering if you keep statistics at all about data around any of that.
I mean, we follow up with everyone that we have permission to follow up with. I mean, there was one client that I had, one of my first clients who came in, and she did not want to be followed up with. And she showed up 5 years later and she said, "Do you remember me?" And I said, "Yeah, you look really familiar." And she said, "I was here 5 years ago, and I had my little girl, and she's starting kindergarten today."
Great.
I mean, she came back in of her own free will. I mean, you know.
Which is wonderful. Yes, that's absolutely wonderful. So we're going to continue. Maureen, did you have a question?
Yeah, I have a few. So you mentioned you have a couple of nurse sonographers. Do you know what credentialing program they received their sonography credentials from? And if you don't, can you get that to us?
Yes, I can. It was,
The name of the credentialing body.
name of, yep.
So I have a couple of questions concerning the scope of practice for nurses, and it may be something we might need to have OPR help us with. But in full disclosure, I'm a registered nurse. I have been for, I forget, 35, 36 years, practicing the whole time in Vermont. And we, unless things have changed, and I'm willing to accept that things have changed, but there are some limitations on what, how extensive informed consent nurses can provide. It is usually, especially when it's about anything that might, not necessarily will, but might involve procedures. The informed consent has to be provided by the provider, the licensed provider, like a physician, nurse practitioner, or a physician assistant. So I have a concern about that. And nurses do some forms of informed consent. We obviously involve our patients in listening and plan of care, and we educate our patients, and we talk with them about if they're agreeable to the plan, this is what we're going to do, this is what it means. But formal informed consent, again, I think, especially around procedural issues, is in the domain of those licensed providers I mentioned earlier. And then similarly, sonography is, even diagnostic sonography, is the sonographer is the person who provides the procedure, but is not usually the person who diagnoses or interprets the imaging. That's done by a radiologist. So
Right.
I'm very concerned that a nurse sonographer, even if they're very skilled, and I've used ultrasound before, and I can tell if a patient has a blood clot in their vein, but it's not my job to make that interpretation officially and inform the patient of that. That is usually a radiologist and sometimes another provider. So I have concerns that you don't have a radiologist reading or interpreting the imaging from the nurse sonographer. And then the last one is a question about, you're providing sounds like a lot of counseling, including for someone that was considering suicide. Do you have anyone that works in your place of business that's a licensed clinical mental health counselor? Anyone that has?
Not at this time. We have a biblical counselor and a life coach.
And what is their training? To counsel people with
board certified trained.
Board certified in what?
In biblical counsel and life coaching. And all of our ultrasound reports get sent to our medical director.
And your medical director is trained in radiologic interpretation of ultrasounds? And your medical director then, who's the person that tells the pregnant person what the results are?
The pregnant person sees for themselves what the results are.
What's that?
The pregnant person sees for themselves what the results are. They see their baby, they see the heartbeat. They're making their own interpretations, and then the doctor follows up as needed.
The pregnant person can interpret whether or not they have a healthy, viable pregnancy, and they can interpret whether or not there's an ectopic pregnancy.
Well, they're seeing it themselves. They know, it's pretty easy to distinguish a baby, a growing baby. But the nurse tells her, the gestational age and the measurements and things like that.
Thank you. That I have grave concerns about that process.
So we're going to need to stop. Our next testimony, our witness will be in around 10. So we'll probably go till about 5 after. So I have a list of people, but I'm going to those who haven't spoken first. So Alan, you're next. I
was just wondering if you have the data on the age that of your clients, minors compared to adults.
Yes, actually, it's interesting. A lot of people think that we serve, more young people, but right now it's 30% of women who come to us are between 24 and 30. And a lower percentage. We have a lower percentage. I think it's like 10% are under 18.
Daisy, I know, I have you on the list. Daisy. I'm sorry, Alan, are you done?
Yeah.
Okay, Daisy.
My question, I think Mari covered most of them. It was just around when, I appreciate that you were able to, or your staff were able to recognize when there was a need for other services such as the patients you mentioned that had need for suicide prevention supports and some domestic violence or anger management. And I was hoping that you were going to mention that you had MOUs or some sort of formal arrangements with other providers that might be able to provide those services. But it doesn't sound like you do.
No, we refer out if they need more counseling or more help. We refer to Howard Center, and if they need more medical help, we refer to either UVM or to Community Health Center.
Do you have formal memos of understanding or formal arrangements with those entities?
Oh, I just have a verbal with Lauren McAfee of UVM.
Okay. And the other question is, it sounds like you're doing an incredible amount of ultrasounds. How do patients get billed for those?
I'm sorry? We don't charge for our services.
So who pays for the ultrasounds or services?
We don't charge for any of our services. We provide that all free of charge.
Through donations and fundraising?
Yes.
Are you good, Daisy?
Yeah, thank you.
Melanie?
Mari and Daisy asked many of my questions, but I was curious. You said you were referred to by the Howard Center. I'm curious about how the relationship you have with the Howard Center, and is that something that happens frequently, and who do you work with at the Howard Center?
It's random. Sometimes we get referrals from DCF, sometimes we get referrals from Planned Parenthood, sometimes we get referrals from, other sources like the Howard Center. But we don't have one particular person that we work with.
How is that? How are those referrals documented? Are they and followed up on? I was curious about the paper trail, if you will.
Yeah, we chart everything, and we have the client sign off on any authorizations if we need to share information.
You good, Melanie?
Yeah, I am.
Alyssa?
I was just wondering how many clients you see per year, individuals.
Yeah, I think last year it was 120, about 120 last year.
Thank you. Leslie?
I was hoping, thanks Deb, if you could tell us the name of your medical director?
Yes, Dr. Jessica Whalen.
Thank you. And Brian, and then I think we're going to wrap up.
You mentioned earlier that there was a situation where someone was suicidal. I'm curious, what's the protocol when someone's suicidal? Like, what is the policy or protocol around how people manage that to just make sure they're safe?
Yeah, we invited them in, and we also made several phone calls. I can't remember now, it was several years ago, but I know that we called the suicide prevention line and, referred them to that as well.
Okay.
Thank you. Yeah, thanks.
Any other questions? Deb, thank you. We appreciate, I know you just came back from vacation, so, well, actually, we have one more question.
Yeah. In your opinion, any of the information that you give out, do you feel that you're misleading
No,
the clients that come into your place?
no.
Because
And that's one of-
findings, there's some statements about providing misleading information. You aware of that?
No. No, that's what I'm asking. I have not seen anything that says that we're providing false or misleading information.
I'll find that out. I'll get that from that statement.
Okay, Leslie and then Alyssa, and then we're really done.
Thanks, Deb, for telling me Dr. Jessica Whalen's information. I see that she's a naturopathic physician. Does she have training in ultrasound interpretation and those kinds of things?
Yes.
You good, Leslie? All right. Thank you again, Deb. We appreciate the care you do provide to Vermonters and for taking the time to talk to us today about Aspire Now. If we have any questions, I might reach out to you. But we'll let you get back to what is probably a busy day. So thank you, Deb. Have a wonderful day.
You too. Bye.
Bye. So I think Sarah just walked in. I wasn't sure, are we waiting for Patty or do you want to?
I think she's running over. She's going to be here as soon as possible, so I am hearing her.
Okay, so do you want to start or do you want us to wait?
You're fine.
No, I'm happy to.
Okay, great. Come on up.
Things go well.
Thank you for being here. I think she's another testimony in the building,
Yes.
which is very important to this committee as well. So thank you for being here. So, and I'm not doing well with last names today. So Sarah Aceves, see, I knew that was going to be completely wrong. So if you can introduce yourself for the record and who you work for and all that good stuff.
My name is Sarah Aceves. I am with the Attorney General's Office in the Consumer Protection Division.
Great, thank you.
Consumer protection?
Yes.
Okay, sorry, couldn't hear.
Great. So I'm sure we have lots of questions, but I didn't know if you had prepared testimony as well.
I can give a sort of a brief synopsis of why I'm here. We have been asked to come in to testify specifically on Section 8 of S37, dealing with crisis pregnancy centers. We did testify before Senate Health and Welfare on this as well. And I think generally we are in support of the provision. I think there are some points of flexibility that may best come out through your questions, if that is helpful.
Okay.
And so I'm willing to answer any questions you have.
Okay, great. So, Art.
To our last witness's point, how many complaints have you had about the crisis pregnancy centers throughout the state? As it relates to how many people they see?
We do not have data on how many clients the crisis pregnancy centers see on a regular basis. You may know our office has a partnership with UVM that administers the Consumer Assistance Program, where consumers can call in and lodge complaints about scams or any kind of wrongdoing they've had as the recipient or client of the business. And we have only heard anecdotally about crisis pregnancy centers.
Oh, really? So you've only heard like how
That's right.
in terms of false advertising, misleading statements, misleading anything.
I think it's fair to say that's a national conversation and one that is relevant in Vermont, given the climate around reproductive rights currently. But yes, you're
Okay,
right.
but here in Vermont, which is what I care about, you don't really have any real hard data on.
Only anecdotal.
Thank you.
Can you tell us what some of that anecdotal information is that you've heard?
Sure. I would say it's consistent with what has been talked about at the national level, that crisis pregnancy centers generally can mislead clients into coming to their centers under false pretenses, while oftentimes websites will have a disclaimer that they do not provide abortion services or abortion referrals. There are websites and crisis pregnancy centers that do not have that language on their websites. And when you Google abortion in Vermont, their centers do come up. And so it can be misleading in that respect.
Do you know how many crisis pregnancy centers there are?
I believe there are 7 or 8.
Okay. And do you know if they have to be registered?
They do not.
Okay. Brian?
Are there any documented instances of a crisis pregnancy center violating state law?
Not to my knowledge.
Thank you.
Questions?
You said there's about 7 centers. Different centers or?
Yes.
Okay, can you tell us? Do you know them offhand?
I don't know them offhand. I apologize. I would be happy to get a list.
Well, it doesn't matter, but like I say, if there's an overabundance of one center, just be curious. That's all.
I know that at least 3 of them share a director.
Okay.
But my general sense is that they are separate entities.
Okay,
Yes.
good, thanks.
Another question. So I'll say what I know, and that I know that as a licensed healthcare provider that that my own profession regulates me, and then if there's violations that there's a board that addresses some of that, unless I break state law, and then it might escalate to the state's attorney or someone pressing charges or something. You said that there were no instances of any violations of state law, and I don't know if you would know if there were any other violations of ethics or just anything that might be considered harmful to the public.
I hesitate to answer your question. I don't have any hard data or information for you right now. I'd be happy to get that information. To my knowledge, I think there's a fair amount of discussion around this being kind of an ethical dilemma. The practices that crisis pregnancy centers engage in, whether that is in fact the case in Vermont, I'm not prepared to answer that question.
Yeah, and I understand because I think there's a fine line between ethics and there's not a fine line. There's a line between ethics and law, and so the ethics of a profession sometimes become the law, but our professions often have ethics that are not the law yet, and so things may not be illegal yet that are unethical, and we've gone in this direction where we've made things illegal that are unethical over time, in my experience here at least. So it just would be useful, I guess, for us to learn more about what are the ethics of the various professions providing services in these centers, and what are the laws, and just understanding that landscape better. But I asked you just because I know for consumer protection, well, maybe this is another question. With consumer protection, is it really guided by the law, only the law? And is it really not your place to look at the ethics? Is that the board's this place,
Well, maybe it would be helpful for me to explain what we do a little bit.
That'd be awesome.
Sure. So under Title IX, Section 2453 is the main kind of meat of the Consumer Protection Act, which says that if you engage in unfair or deceptive practices in the marketplace, then you are violating the Consumer Protection Act. Very broad, gives our office lots of discretion for what that means. Generally, in practice, if we receive word that a business is engaging in unfair or deceptive practices, then we have the discretion to, we call it a civil investigative demand, which is a subpoena. We have authority to subpoena that business and ask them, we have reason to believe you violated this law. Please explain to us X, Y, Z. And that starts the process of looking into a business as to whether they've actually violated the law. In this respect, there's debate currently on whether we would have jurisdiction over these types of entities because they provide free services. Typically, the in-commerce portion of the Consumer Protection Act has meant an exchange of services or money. So that could be a barrier here. And what else should I tell you? I guess typically with the investigative process, it's confidential in nature. And so when we are investigating a business, that information is strictly between the Attorney General's office and the business. And ultimately, we want to reach resolution, whether that's monetary and or injunctive relief. Stop doing this unfair or deceptive practice. Oh, and by the way, you need to make these consumers whole, that kind of thing. So that's typically the process. Is that helpful?
It is, because it really clarifies like that it's around business. It sounds like.
Yes.
Yeah.
Ellen?
How does one make a report if they're a consumer that feels like he or she or they have not been served well? How is a report made? Because what I'm thinking of is a vulnerable person who is pregnant, who is in crisis, who feels like maybe they have not had the care that they needed. How does one go about reporting that? And are there any barriers that we could see that maybe underreporting is because people don't feel empowered or able to report? So
Great question. Typically, we get tipped off to issues through our consumer assistance program. So a consumer will call what we call CAP. Consumer will call CAP, lodge a complaint. CAP will either handle that complaint internally through a remediation process that they have in place, or if it's kind of a larger legal issue, it will then refer the matter to our office to then investigate. That's the typical way. We also receive calls to our office ourselves, or even the news. If an issue is in the news, our office the antenna will go up and we will say, oh, we should be looking into this on behalf of consumers. So there are different avenues.
So it doesn't always have to be person-based. It can be the tip from the news
Yes,
or
absolutely.
the jump.
Thank you.
Thanks for coming in.
Thanks for having me.
Have you received, has your office received any complaints about these centers that they're being deceptive in their advertising or anything that's coming out of this center talking about what they do? Has your office received any of those complaints?
To my knowledge, we have not.
So this language is about unfair and deceptive practices. We heard some testimony a little bit ago from a pregnancy crisis center, which being the healthcare committee has at least me a little bit concerned. Their medical director is a naturopathic doctor, and they're the ones analyzing ultrasound information. But that would not, in general, let's say there was someone who came forward and was concerned about that. That would not necessarily go to the AG's office under consumer protection, or would it?
I don't believe it would. And the way the bill is structured currently is that would fall under the Secretary of State's OPR.
Right, OPR. Okay. And because I asked before if these entities are licensed, so they're probably licensed with the state as a business, I would.
They may be registered with the Secretary of State, yes, but I think that's the extent.
That's the extent of it. And so, okay, thank you for that. I think someone had a question, maybe.
I did, but I think Brian got it.
Okay. What if any advertisements does the AG's Consumer Protection Office do in general around reproductive health services? Is there anything?
I would say apart from the Attorney General's campaign platform, where she talked about it, there's very little. I would say if we had more resources that we could absolutely engage in a more, in a broad public awareness campaign.
Okay. Okay. Any other questions for Sarah? If not, I do still want to hear from the Attorney General, so I think what we'll do is take a break until she can arrive, because we don't have, oh no, we have Ann here, don't we? Okay, sorry, Anna. Let's have you leave. And let's turn over to Anna. That actually works out great. And then we'll have Charity come in when she gets there. Anna, are you there? Good morning. How are you? Thank you for coming. So Anna Benvenuto?
Yes.
Okay, got it. Regional Medical Director, Dr. Benvenuto, I should say, from Porter Medical Center. So we would like you to introduce yourself for the record and then provide your testimony. And I think you have a hard stop at 10:30. Is that accurate?
I'm trying to be flexible. I am in clinic today.
Okay,
so
well, we will make sure you leave when you have to leave, but we may have some questions at the end.
Absolutely.
Good.
So good morning. My name is Dr. Anna Benvenuto. I'm a board certified OBGYN, and I've been practicing at Porter Medical Center in Middlebury for the past 10 years. I've also served as Porter's Chief Medical Officer for the last 4. I testify today as a member of the Vermont Medical Society and also as a clinical leader with the University of Vermont Health Network. Just a little bit about myself. As long as I've practiced, I've served in a leadership or have served in a leadership position, I've remained committed to providing a full range of reproductive health care options to patients in our practice, including abortion. In a small community, our patients consistently express gratitude for the ability to receive the types of care that meets their needs in a compassionate and integrated way. While providing abortion care is valuable and necessary health care, it continues to unfortunately be contentious and politically charged. As an abortion provider, I'm cognizant of the potential risk that comes with that decision. I've had to make specific choices about privacy in order to create some protections for my family, knowing that violent and threatening acts are not isolated to providers. I support S37 for the protections from violence and litigation and threats of licensed discipline directed at healthcare providers who are engaging in evidence-based practice. The bill would also help us keep malpractice coverage, which is already a challenge for many OBGYNs across the state. I want to particularly express my concerns as well about the misinformation advanced in our community and other communities by the local so-called Pregnancy Crisis Center. For example, in my community, the name of the practice, my practice, is Porter Women's Health, and the local Crisis Pregnancy Center recently rebranded as the Women's Center. The organization generates materials that are incredibly misleading. I have seen people in my clinic who have received ultrasounds that have been inaccurate. They do not understand it is not a medical facility and that they are not receiving factual medical information. They have sought abortion services only to receive what they characterized as coercive anti-abortion counseling and inaccurate information such as reversing medical abortion for which there is no approved treatment. As a physician who believes in honoring patient choice and creating care environments that support individual and evidence-based decision-making, it is infuriating that this type of organization is allowed to continue to operate in a manner that is deceptive and provides inaccurate counseling about healthcare. Strengthening language that could result in the restriction or elimination of misleading practices that originate in Crisis Pregnancy Center is critically important to me. I've been shocked by the way they've been able to generate and perpetuate untrue messages about the services they provide. I'm consistently appalled by what they have the ways that they have chosen office sites and changed the names or logos of their organizations to more closely match the location and names of OBGYN practices. When their website was recently updated, there were new sections included specifically about abortion until you reach the very bottom. After they offer ultrasounds and visits for counseling, they mention they don't provide abortion. Yet when you Google abortion service Middlebury, Vermont, they are the first option that comes up. Even savvy medical consumers have been misled by their website when seeking care, and I find it reprehensible and irresponsible that their misleading practices are allowed to continue. Since I testified last, I received an outpouring with the Senate. I received an outpouring of support and gratitude from healthcare providers across our region and heard from staff and patients who are appreciative that our legislators are taking up this important issue with the intention of protecting our healthcare providers, preserving access to vital healthcare, and working to eliminate deceptive practices that harm our patients. I would like to extend my personal gratitude for the courage and foresight of our legislators who are working on behalf of patients across our state to both protect them from medical misinformation, but to also advocate for the safety of our healthcare providers. Thank you for your time and support of this vital work, and I'm happy to answer any questions.
And the hands are popping up. So first, Anna, if you have time, it looks like that you read something. If you could submit that to our committee assistant, that would be great. We're going to start with Topper.
Thanks for coming in. You made some pretty strong statements about the center in your area.
Yes.
When things like this happen in your area, what recourse do you take? What do you have? Where can you report this?
Yeah, that's really an interesting question. I'm not really familiar with the best way to report something like this when people are getting misinformation. I see that my role in the moment is to think about the ways in which I can support the person and provide counseling for their and answer their questions. I haven't spent much time then registering complaints on patients' behalf.
Right.
So I have two questions. Have you seen any patients who have experienced emotional or physical harm from one of these centers?
Yes.
I know you probably can't be too detailed because of confidentiality, but is there any way you could give us kind of a high level description of the kind of harm? It doesn't have to be very specific.
Yeah, I can talk broadly about a couple of concepts. I won't talk about patients specifically.
Yes.
I will say that there are a few things that come to mind. I have seen people who were told that they had an ultrasound and they were given the wrong due date, and then told they didn't have an option to have an abortion because they were too far along, and it was the completely incorrect due date. So they felt like their choice had been taken away from them. I also have had people who have been told that they might have come to see me for care and chosen a medication abortion and then been told after that they could reverse it, which is not actually there is no FDA approved medication for reversing it. And so the emotional harm that comes from being told incorrect medical information is really confusing to people during times that they're already feeling confused. And then I've also had people who have been told that they're likely having a miscarriage, only to then come in and see us much later in pregnancy, having not gotten any prenatal care. And that also, I can't name specific harms that were associated with that, but certainly there are a lot of risks. People also, I haven't seen this myself in my practice, but I've had partners who people have thought they were a different due date than they thought, and they had complex medical issues that really, or were on medications that could cause harm to a developing baby. And they thought they were receiving medical care, but they weren't receiving medical care. And so those are things that for us in our practice, we're always talking about in the early part of pregnancy. What are your medications? What are your healthcare risks? So that we can have a conversation about a healthy pregnancy.
You go for the second question.
I gotta go. Go
The
ahead.
second question, that was very helpful. Thank you. That is kind of exactly what I was hoping we can get, is just some concrete examples of like what the consequences have been. I'm a licensed social worker. I don't feel like I'm qualified to give detailed advice around pregnancy. Like I might talk with a person about their choices and the consequences and think through that, but I would never like be giving advice on what they should do. I'm curious who in the medical profession is qualified to give that advice. Because I'm a licensed social worker and I'm not. So like who is, you know?
Yeah, I think it depends on the type of care, right? So all professions have a scope of practice. So it depends on your training and your education. So even within physicians, I will say physicians who might go into internal medicine, so adult medicine, don't feel comfortable providing pregnancy related counseling as a physician. There are, depending on your training as a nurse, there's a scope of what types of care you might provide and what you might provide. And it depends a little bit on additional training you might have. So, and then further, we have advanced practice providers. So in my practice, I work with both multiple nurse midwives and a nurse practitioner who's specifically trained in women's health. But I work across our organization. We have physician's assistants who work in orthopedics, and they would never counsel anyone around pregnancy care.
Thank you.
Anna, I'm going to jump in and then I'll go back to the list. Anna, could you describe the clinical guidelines for when an ultrasound should be used during a pregnancy, how it's used in pregnancy, and who is qualified and has the scope of practice to read results?
Yeah, so
performing them.
And
performing them. Well, so this is as challenging, but for me as a physician, so there's specific training that we get for performing ultrasound. And so especially in early pregnancy, the way to actually get an accurate ultrasound is actually using a specific type of ultrasound probe that goes into the vagina. So when people are below about 10 weeks of pregnancy, it's incredibly challenging to actually accurately measure the how far along people are in their pregnancy. And so in that, in our organization, the people who do that, we have physicians who do that, and we have some ultrasound technicians who are specially trained in that type of ultrasound procedure. When is it indicated? We generally recommend that for all early pregnancy care that we should have an early ultrasound. We have some people who don't choose to do that because they feel very clear about when they got pregnant and they don't want ultrasound in the early part of pregnancy. So we do see that, but standard practice in our care and what I see with colleagues across the state is that almost everyone is getting an early pregnancy ultrasound. And the reason we do that is to make sure we know, is there one developing pregnancy? Are there twins or triplets? Is the pregnancy developing normally? The number of times I see people who are off by several weeks in either direction based on their period date. And also to make sure that there's not a pregnancy developing outside the uterus, which could end up in a surgical emergency for the person who's pregnant.
Great. Thank you, Mari. And then Alyssa. No, Leslie.
You asked my question.
Okay. And then Art. So Mari and then Art.
Thank you. And Dr. Benvenuto, I'm a registered nurse. I don't know if you heard my earlier questions. Were you on earlier?
I didn't hear your earlier question.
Okay. A number of them have been addressed, so I'll just touch on some of my concerns that I asked the previous witness from Aspire. The issue of informed consent and who's really qualified to give informed consent, and that's related to scope of practice as well. And an example I gave is that I, as a nurse trained in placing central lines like PICC lines using ultrasound, I can tell when there's an occluding DVT in a blood vessel, but I can't, within my scope of practice, diagnose that there is a DVT. I can pass that information along to the provider. So I have concern with what I heard about the ultrasound practices and information given about abortions, who is qualified at those centers to really give informed consent about abortions and even about the ultrasounds, especially if it's transvaginal and not pelvic, as you said. The transvaginal ultrasounds are used earlier, or necessary earlier on in pregnancy. So informed consent. And then I asked about who in the Aspire Center was interpreting the ultrasound. The nurse sonographer, it sounds like they are credentialed, but in my understanding, in my practice, it is radiologists or providers with specific radiologic interpretive training that read the results of the ultrasound, not the nurse sonographer, not the patient, as was suggested. The patient can see for themselves that it's a healthy baby is what we were told. So I think those are all of my concerns, if you could address those.
Sure. So informed consent, there's some pretty clear guidelines around, at least in the medical field. And so this is where it's hard for me to comment some on what's happening in the crisis pregnancy centers, because they're not medical facilities. They're not regulated as medical facilities. They're not licensed as medical facilities, but they're practicing in similar ways, which is one of my biggest concerns. So it's hard for me to comment on their practices because they're practicing well outside of where I practice and where I trained. So for me, informed consent, it does rely on the person who is providing the consent to the person who's undergoing a procedure, having the familiarity with the risks and benefits, drawbacks, and anticipated outcomes of any given procedure. So you actually have to have a lot of detailed knowledge. So like I might know something about a hip replacement, but I am not going to be going and obtaining informed consent about that. I will do it only within my specialty. And certainly other members of a healthcare team can help with the informed consent process. It can be delegated to other healthcare professionals within, but it has to be within their scope of practice and their knowledge base. In terms of scope of practice and the use of certain technology, I have grave concerns about the way ultrasound is being used. I don't have enough knowledge about what each crisis pregnancy center is doing in terms of who's performing and who's reading them, because I think there's such variation in this. My understanding from our local one is that they didn't have any sort of medical doctor who was interpreting studies, but recently they said maybe they have someone who's reading something remotely. It's very hard to understand the granular details of what's happening within their center. And so for me, in our practice, there's no one like the physicians or the people who read all the ultrasounds. Except for in limited cases where, like for example, our nurse midwives do some small, not early pregnancy ultrasound, but they have a very privileges for a certain types of ultrasounds for which they've demonstrated competence that they are allowed to do that. Does that answer your question, Mary?
Yes, and the competency, you're adding another layer here. There's regular competency assessments, I assume, within the and quality measures that are always embedded in those practices.
Yes, we don't have any sort of numbers-based competency, but we do have regular QA and QI of all types of our practice, including radiology.
Thank you.
Did you have a question?
Yeah, thank you. The Women's Center, you referenced, I think that's the name of the local agency there, local pregnancy crisis pregnancy center. Do they charge for their services, do you know?
I do not know, except for their advertising, which they advertise free ultrasounds. They have a sign in front of their office that says free pregnancy ultrasounds. That's the most that I know. I don't believe that they charge for any other services.
Okay, so they're free. Have you ever gone to them with concerns that you expressed to us about how they, misdiagnose an ultrasound or tell somebody the wrong thing? Have you ever brought it to their attention and say, you know, you folks, I like what you do, but you do, you know, can you watch what you tell people?
So I have not, and I don't actually like what they do. I don't think that they're providing value in our community. And I don't see the benefit of having them in our community at all. So I have not met with them to do this. I think partially, I will be honest, for some level of, it took a long time before we were really open in our practice that we were providing abortions, I'll be honest, because of the concerns about safety. And so it took a little bit for me to feel comfortable actually coming out, using my name and talking about our services and talking out against this because of fear. And so I have not been really working with them because of what I've seen from other crisis pregnancy centers and their tactics, and some concerns about myself and my family in exposing myself in that way.
Do you tell patients that come to you for an abortion everything that goes on with an abortion, the risks, what the procedure, what it does? Do you explain that, and also what happens with a medicated abortion when they take a couple pills and it does what it does? You tell them this?
Yeah, so actually this is part of what Mari was talking about in terms of informed consent. Anything that we do, we talk about in detail, any procedure, any medication that we use, any of the risks that could happen. And specifically with medication abortion, there's specifically a handout that we provide to them where they have to sign off on the education that we provide.
And your services aren't free, obviously. They pay as you go. Operation yours.
Like with any healthcare provision there.
Got it. Thank you.
All right, we have one last question and then we're going to wrap up because I know your time is valuable and we do have the Attorney General here and we got.
I'll try to cut to the chase and talk fast. You talked about how with ultrasounds, how it sounds, or maybe, I don't know if you said this, but we were in this discussion today. We were hearing how ultrasounds are read remotely. Can you just share a little bit about, like, as a doctor, if you are looking at a scan remotely, what are the kind of guidelines for doing that? What is standard medical practice you would follow?
Oh, sure. So I do actually read, I would say not remotely because I'm in the same office, but for example, we have ultrasound techs and they push the images through to a computer system and I look at all of the pictures. But as part of that, I'm looking at it mostly in real time where the person is still in the office. So if I have any concerns, I might do follow-up pictures myself, because if I don't see something or if I see something that I'm concerned about, then I would do that follow-up. But certainly radiology there's so many examples of where people are reading more remotely. The downfall is if there is something that you're concerned about or you feel is incomplete, if you don't have real-time access to the images, there just needs to be follow-up.
Thank you.
Great. Anna, thank you very much for your testimony and all that you do for Vermonters. And if you could send your written testimony to our committee assistant, that would be great. So thank you very much. Have a great day. And now we're going to have Charity Clark, our Attorney General, come out and finish that testimony. Welcome.
Thank you. I'm sorry, I'm so tardy.
No, it's okay. It happens.
Okay, so really briefly, we are excited about this bill. We support this bill. We are here to talk about Section 8. Our office are consumer experts, so this obviously is a bill that is based on our Consumer Protection Act. To just refresh, and I'm sorry that I wasn't here to hear Assistant Attorney General Sarah Sevis, so she might have addressed this, but a consumer in Vermont statute is defined as someone who is buying services or goods, and if a service is free, currently that service is not covered by the Consumer Protection Act because the person getting that service or that good is getting it for free. So what this section does is says, look, the Consumer Protection Act, frankly, isn't just to protect consumers, it's to protect the marketplace. Because we want a marketplace with integrity where people can trust the services and the products that they're purchasing and know that no one's lying to them or misrepresenting. And so the bill responds to that by saying in this environment, in this marketplace, you shouldn't be allowed to lie. You shouldn't be allowed to misrepresent or be fraudulent. I do think that it's worth, based on what I just said, I do think it's worth making a change which would broaden the language a little bit. So let's see, where would that be? So as I'm on page 15 of the bill by, 2493, Unfair and Deceptive Act. So this says it is an unfair and deceptive, and I can work on specific language. I don't actually have the specific language, but this is saying it is an unfair and deceptive act in practice in commerce and a violation of 2453, which is the Consumer Protection Act. This is all very familiar to a consumer lawyer like me. For any limited services pregnancy center to disseminate. Now, I'm thinking, why not just make it any entity, regardless of whether their services and goods are free, shouldn't be, lying in the marketplace. It protects the integrity of the marketplace. It gives us comfort in making purchases, which is good for the economy, which is good for, we need to buy things, we need services. So that would be the change that I would make. I'm sorry, I don't have exact.
No, that's okay.
That's helpful.
That's fine.
That's a better approach.
Okay, so we would basically change for any limited services pregnancy center to something that you will recommend to legislators.
Right. Yeah.
Okay. Before we have questions, anything else you wanted to?
No, that's just the main.
Okay, Topper.
Nice to have you here.
Thank you. It's nice to be here.
Would you make that change in the findings of this bill too?
I didn't really focus on the findings, to be honest.
In Section 8.
Yeah, I didn't really focus on the findings. So I don't want to weigh in on them without having read them carefully.
Okay.
Think about that, sorry.
Okay, let us know. Any other questions?
Oh, thank you.
Brian?
Yeah, so I heard you say, and also Assistant Attorney General, is that your title?
Yes.
And the Assistant Attorney General say that one of the challenges here is that when something's free, they're not covered by the consumer protection law, but I'm thinking more broadly in terms of liability. And I wrote this down so I could be clear, if someone gives you something for free and it hurts you, what is the liability? Because my understanding of liability is some part of it is the cost, that it's had on you. So if you paid for something, part of the liability is, well, they have to give you back the money. But what about the harm it caused? If a person goes to a pregnancy crisis center, I don't remember the order, and then down the road they have a medical complication because they were given the wrong advice by someone who's not a medical provider. What is the liability? Is that agency currently, or that organization currently liable under state law for the medical expenses, for the harm? So I think you get the picture, and I'm curious your thoughts on that. Yeah.
So my lawyer brain is clicking into place. If I were that person's lawyer, I'd be thinking, okay, what are my options? What are is it medical malpractice? Is it breach of contract? Is it regular negligence? This is just Consumer Protection Act. So it doesn't say this is the problem, here's all the solutions. It's saying here's a solution that doesn't currently exist because these pregnancy centers or whoever are free. So the Consumer Protection Act has a specific, there's 3 elements, so it would probably be the same calculation. Was there a misrepresentation in the marketplace? Was the consumer's reliance on that misrepresentation reasonable? And was that reliance material to the ultimate choice the consumer made? So that's what we're looking at when we talk about this. That's the liability have you violated the Consumer Protection Act? And that would be how you would violate is those 3 things that I mentioned. Does that make sense?
Yeah, but if we don't change the law then there's no other liability currently, or there might be, but it's other things
I haven't even thought about it. It's very fact specific too. Does this person have a license? I mean, when especially if you should get a plaintiff's lawyer in here, they can probably give you a whole laundry list of possibilities.
Okay.
Good.
Yeah, you said you hadn't thought about it. So I mean, like maybe we could just think more about this in our testimony and discussion. How do we kind of understand the full scope of harm that's caused and the ways people can get recourse, you know? So.
Art?
I would just to make a comment about that. This section deals with advertising and deceptive advertising. It has nothing to do with what information was disseminated to the patient in terms of a prognosis.
Right.
This is about advertising and false advertising, misleading information. So we didn't hear anything concrete from, and I forget your title and name, I'm very sorry. I wondered if you could expound any more on any specific complaints that you've had, and how many over the many years these folks have been open now. They've been open quite a number of years.
Yep, sure. So we run the Consumer Assistance Program, for those of you unfamiliar, who receive complaints from consumers and make referrals when a complaint isn't appropriate. In this case, because currently the law would not include this type of misrepresentation in the market, it's not covered by the Consumer Protection Act.
But surely someone could come forward and say,
oh yeah, and we would make a referral, but we wouldn't log it as a complaint. So there wouldn't be any complaints. It's not a complaint because they're not consumers.
Okay.
Because it's free. Yeah.
Have you checked with the Secretary of State to see if there are any complaints?
Do that.
I haven't, no, I haven't.
We could do that.
Okay.
My last question, and we'll let you go, or our last question. Just lost. Oh, education, consumer education. So right now, this really, it doesn't fall under your agency's purview, right? So, but if this passes, would there be consumer education? Would there be something on the website? How would people know that they could reach out to you specific to this type of situation?
Yeah, we would probably do, we do this, that's like summer projects for us, is making guidance for businesses and consumers. I would probably do social media. I'd probably make some reels we put on our website, and make sure that the Consumer Assistance Program is aware of the new, because it would be new to have, a consumer be someone who didn't necessarily pay for it as long as it's out in the marketplace.
Right. Okay, great. Any other, Daisy?
I keep, Brian, you're making a great point about liability and risk, but I keep wanting to kind of connect it to someone who testified earlier on health ethics. And I guess there's a connection in there that I'm looking for. I wonder if you have anything to help me make the connection to risk and health risks I feel that we're making by not enacting this. I just think that we're subjecting people in Vermont to extreme health risks. And I think the last person who testified kind of spoke to that, in that these centers, she didn't feel we're adding any value in her medical expertise because essentially of the health risk that they're adding. Is there any way to, I feel like the liability piece is sort of getting at that, but I think even more, through a health lens, I see that there's extreme health risk here with having people who aren't licensed and credentialed in a way that connects them with our larger health system. I don't know if there's any way of looking at that through a legal lens or not.
But we can talk to OPR.
Yeah.
And see what they do with licensing.
And thank you for your wonderful social media feeds, which have taught me so much about consumer protection.
Oh, great. Thank you very much.
My pleasure.
We are going to take, sorry, folks who are here, I know we're late. We're going to take a 15-minute break and be back at 11. We can go off live.